Hello friends, warm welcome to all to the channel World of Zoology. Back to our lecture series on common human diseases and disorders. And today's topic of discussion is from paper 2 unit 3, that is depression. Depression is experiencing a sad or depressed mood or an inability to feel pleasure. Depression is in short a complex disease. No one knows exact reason. It happens for a variety of reasons. Some people have depression during serious medical illness. Others may have depression with life changes such as move or death of the close relatives, that is loved ones. Still others have family history of depression. Those who may have depression and feel overwhelmed with sadness or loneliness for no reason. The reason is not known. Here are some main causes of depression. Lots of things can increase the chance of depression, including following main causes of depression, such as 1. That is abuse, sexual, physical, or emotional abuse can make you more vulnerable to depression later in the life stages or in the later part of the life. Second factor or the cause of the depression, it may be because of the age. People who are elderly are at a high risk of depression that can be made worsened by other factors such as living alone and having lack of social support. That is loneliness in the elderly person may have risk factor more. Then next point, that is medication. Certain medication or some drugs such as isotretinoin used to treat acne, the antiviral drug interferon alpha and corticosteroids can increase your risk of depression. That is, some of the medicines are the factors which are responsible for the depression. Next factor, that is fourth one, is the conflict. Depression in someone who has the biological vulnerability to it may result from personal conflicts or disputes with family members or with friends. Next factor, that is death or loss. Sadness after death or loss of loved one, though natural, can increase the risk of depression. Next factor, that is or the cause of the depression, that is gender. Women are more twice as likely as men to become depressed. That is gender based. Women are more vulnerable for the depression compared with the male. No one sure why. The hormonal changes that women go through at different stages of their lives may play important role. Maybe at the time of the menopause, the depression is caused in case of the someone's, and which is one of the factor, or we can give example in that respect. Now the next factor, that is genes. A family history of depression may increase the risk, that is hereditary. It's thought that depression is a complex trait, meaning there are probable many different genes that each exert small effect rather than single gene contributes a disease risk. Means it is overall effect of different genes that exert the symptoms of the depression. The genetics of depression like most psychiatric disorder, are not as simple or straightforward as in purely genetic diseases, which are just like cystic fibrosis or the others. Now, the next factor that is, or the cause of the depression, that is major events. Even good events such as starting a new job, graduating, or getting married can lead to depression in case of someone's. So, can moving lose a job in income? Sorry, moving a job or changing a job, losing job or income, getting divorce, retiring from the job. However, the symptoms of the clinical depression is never just a normal response to stressful life event. That means depression is caused due to several factors, even personal problems, serious illness. These are the some of the causes of the depression. Not a single reason is responsible for depression, and the biology related to depression, that is, researchers have noted difference in the brain of the people who have clinical depression compared with those who do not have. uh, Difference in the hippocampus region, which is small part of the brain, and that is vital for the or play important role in the storage of the memories, appears to be smaller in some people with a history of depression than which are without, never depressed. These are various reasons and the biology behind the process of the depression. We'll now move towards the next point, that is nothing but type of depression. One, that is seasonal affective disorder, SAD. Second one, psychotic depression. Third one, depression in teens. Fourth one, bipolar disorder. Now we'll consider one by one. First one, that is seasonal affective disorder, which is abbreviated as SAD, is a period of major depression that most often happens during winter months when days are short and one gets less and less sunlight, and antidepressant and light therapy can help the patient for healing or helpful for healing. Second one, that is psychotic depression. People with psychotic depression have the symptoms of major depression along with psychotic symptoms such as hallucination, that is seeing or hearing the things which aren't exist, means imaginary things, imaginary people, delusions, that is false beliefs, paranoia, wrongly believing that others are trying to harm you. A combination of antidepressant and antipsychotic drugs can treat psychotic depression. ECT, that is electroconvulsive therapy, may also be one of the option or which can be used for treating. Now we'll consider the third one, that is depression in teens. It is common in teenage to occasionally feel unhappy. However, when the unhappiness lasts for more than 2 weeks and the teens experience other symptoms of depression, then he or she may be suffering from adolescent depression, because during this age, adolescent age, he or she is having more hormonal changes that are also related with the emotional changes at this age, and therefore chances of depression are more during adolescent stage. Now we'll consider the next, that is bipolar disorder. has mood episodes that range from extremes of high energy with up mood and low depressive period with low mood. When it is in the low phase, major symptoms of depression are observed in that particular individual predominantly, or in more pronounced effect is observed in that particular individual uh, in this case. Now the next point, that is nothing but detection of depression. A key sign of depression is either depressed mood or loss of interest in any activity once enjoyed. For a diagnosis of depression, these signs should be present most of the day, either daily or nearly daily for at least 2 weeks. In addition, the depressive symptoms needs to cause clinically significant distress or impairment. According to DSM-5, a manual used for diagnostic purpose of the mental disorders, depression occurs when you have at least 5 of the following symptoms at the same time. A depressed mood during most of the day, particularly in morning session. Fatigue or loss of energy almost every day. That is feeling having no energy for any work or doing things with interest. Feeling of worthlessness or guilty almost every day. Impaired concentration and indecisiveness. Insomnia and inability to sleep or hypersomnia. That is either difficulty in sleeping or excessive sleeping almost every day. Markedly diminished interest or pleasure in almost all activities nearly every day. Recurring thoughts of death or suicide, not just fearing death. A sense of restlessness or being slowed down. Significant weight loss or weight gain. That means persons either excessive overeating is observed, or the lack of eating is also observed in the patient. Thought or talk of death or suicide. Thoughts or talk of self harm, harm to other, aggressive behavior. These are also the symptoms of the depression. Of these all symptoms, if at least 5 symptoms appear in a particular person, then the person is said to be in the depression, in the phase of the depression. Now we'll consider the next point, precautionary measure and remedy for depression. In nuclear families and with increasing standards of living, blended with inflation, both the parents are working and strive to reach career goals, at times ignoring the basic psychological needs of each other and their children. Moreover, electronic revolution has reduced interpersonal interaction within the family and also in the society. That is lack of communication due to electronic revolution like mobile, laptop, etc. Lack of communication gives less scope in understanding each other's problem and finding collective solution, which are observed in the previous families, joint families. This magnifies the problem and lead to depression many times. Talking heart to heart, allowing a person to ventilate, releases the pressure on the mind, and it proved to be an effective therapy. That is open-mindedness. In initial stages of depression, it is essential. Following could be some of the alternatives or the remedy for depression. In the early stages, talk therapy for depression. Cognitive behavioral therapy help you to see how behavior and way you think about the things plays a role in your depression. Then interpersonal therapy focus on your relationship with other people and how they affect you. That is relationship within the family and also in the society. Problem solving therapy focuses on specific problems you faced. That is a particular event in the life that causes problem of the depression, and that helps you to find a solution on that. Now we'll consider the last point, that is medicine for depression. Medicines are the other key treatment for depression. The FDA has approved 3 medicines to treat depression phase, and besides these, Seroquel, Latudate, olanzapine, besides these medicines or the combination of all these, doctors sometimes prescribe other drugs, and these drugs includes selective serotonin reuptake inhibitor, that is SSRI, serotonin and norepinephrine reuptake inhibitors, which are also given as a medicine, tricyclic antidepressant, and monoamine oxidase inhibitors. Other antidepressant medications which are used, such as alpenzin. These are actually the unique antidepressant options with side effects that are usually mild compared with the other medicines. Sometimes ECT is also used, that is electroconvulsive therapy is also used for treating the patient with depression. These are all points which are covered during this lecture. Thank you for watching this video. Share this video for the benefit of the maximum students. Thank you once again.